Welcome to the Understanding and Recognizing Vicarious Trauma lesson. This is one of 5 lessons in the Self-Care for Trauma Workers unit of the Clinical Workshop curriculum. These lessons are designed to aid in training on self-care, specifically for people who work with torture and trauma survivors. The module player controls are located at the bottom of the window. Here in the bottom left, you will find a button to play and to pause the module. Use this button to go back to the previous screen, or click this button if you want to move ahead to the next screen. Clicking on the icon that looks like a small door will return you to the beginning of the module. In the bottom right corner, click the speaker icon to turn sound on or off. Click the closed captioning or CC button to see a written transcript of the audio at the bottom of the screen. Clicking the X button will close the module. On the left side of the player, you will find a table of contents listing screens and topics within the course. You can also click on these links if you wish to go to a specific screen or topic that you have already visited in the course. During the module, you may also see prompts to interact with items on the screen, such as click here or place your mouse on this item. These prompts or instructions will be blue. As you go through this lesson, you should be prepared with a pen or pencil and a notebook or pad of paper that you can use as a journal for exercises and activities in the lesson. You may also be invited to access additional resources in the PATH Portal Clinical Group and to take part in discussions in the clinical group forums. There you can share your experiences, questions, and advice with other partners around the world who also work with torture and trauma survivors. Now, let's get started.
Greetings. I'm Dr. David Gangsei, Clinical Advisor with CVT International Services. I help support the staff who participate in our international programs. I will be your guide for this lesson, which focuses on the experience that we call vicarious trauma. By better understanding vicarious trauma, we can better recognize when and how it affects us, and take steps to effectively manage it.
At the end of this lesson, you should be able to understand and describe vicarious trauma and how it affects people who work with trauma survivors. Recognize the signs and negative effects of vicarious trauma as they occur, whether mildly or more intensely, in yourself or your coworkers. And begin to learn how to manage vicarious trauma and protect your well-being.
That final topic will be covered in more detail in later sessions. However, if in the course of this lesson you recognize that you or someone close to you may be experiencing vicarious trauma right now, we encourage you to take steps to care for yourself right away. One of the best ways to do that is to discuss your experience with a trusted supervisor or colleague. We also include some resources at the end of this lesson to guide you in developing a self-care plan. What do we mean by vicarious trauma? To have a vicarious experience means to feel or react to another person's experience almost as though it were your own experience. Vicarious trauma, or VT as we will call it, refers to the mental, emotional, and physical depletion or symptoms that we may experience after exposure to the traumatic experiences of others. In other words, after we hear what has happened to our clients. It is a process of change that happens because we care about people who have been hurt, and we feel a desire and a responsibility to help them. Over time, as we hear about or observe torture and traumatic events that happen to our clients, their families, or their communities, it can affect our own psychological and physical health. Many people who work with survivors of torture or war trauma and who listen with empathy to survivors' stories have the experience of vicarious trauma at some time. This is normal. It doesn't mean that we are sick or weak. It is quite possible that you have experienced it in some form yourself. I know I have. But what does VT feel like? How does it affect us? Vicarious trauma can affect our mental, emotional, and physical well-being. It can even affect our behavior. Let's discuss some examples of how this works. As we go through these examples, consider your own experiences. Do any of these examples sound familiar? Mentally, VT can affect the way we think. One sign may be intrusive thoughts. This means that thoughts or images about something you heard or someone who you are worried about keep coming in your mind even when you are away from work and busy with other things, or when you're trying to rest. For example, imagine Mary has been working intensively with a group of clients who had been kidnapped. They have told her detailed stories of their experiences, and she has tried to help them. Now, Mary keeps imagining kidnappings. She envisions her clients' experiences. She imagines what it must have been like for them. She imagines specific sights and sounds. She has these thoughts even when she is away from work or at home with her family, even when she is trying to rest or to think about other things. These intrusive thoughts could be a sign of VT. Similarly, she may have occasional or frequent nightmares that she or a loved one is being kidnapped. She may even be surprised to have flashbacks, frightening or painful memories of a trauma she herself experienced earlier in life. Intrusive thoughts, nightmares, and flashbacks can all be signs of vicarious trauma. Vicarious trauma can also affect our overall attitudes or outlook on life. A person may become more pessimistic, dwelling on the bad side of human nature, or become preoccupied with danger and feel constantly worried and insecure, either about their own safety or the safety of clients, colleagues, family, or friends. These attitudes or beliefs can become so strong that they block out the positive, leading to a distorted view of reality which negatively affects emotions and behaviors. You likely recognize these mental effects as markers of post-traumatic stress disorder. Vicarious trauma can include many PTSD symptoms, so it is not unusual for trauma treatment providers to experience them. Vicarious trauma can also affect our own emotional state. Consider the example of Sal. Sal has been working for several months helping survivors of a recent trauma. He has been very dedicated to his work and to his clients. Sal is normally a very patient man, and he has loved to play football since he was a child. But lately his friends and co-workers notice he seems irritable. He loses his temper easily, and he does not enjoy playing or watching football matches like he used to. He also reacts angrily with his wife and children. Sal may not be aware that these changes are happening, but the other people in his life do notice, and they may tell him what they are seeing. If Sal learns about vicarious trauma, he may be relieved to understand what is going on, and that there's a logical reason for it. He may recognize that he is experiencing consequences of vicarious trauma that are affecting his emotional state. There are many ways that vicarious trauma can affect our emotional state. One way might be increased irritability, like Sal experienced. VT can also appear as generalized feelings of sadness, depression, anxiety, helplessness, or even despair. We may feel inadequate or find it difficult to feel good about ourselves. We might start to doubt our ability to help our clients. Also, as you heard in Sal's story, VT can lead us to feel disconnected from loved ones, or to lose interest and enthusiasm for things we used to enjoy. Loss of interest or motivation can directly affect our work and other areas of life. Even our physical bodies can suffer the effects of VT. For some people, VT shows up as headaches, back and neck aches, or muscle aches. Stomach aches and other digestive problems can also develop. A common physical sign of VT is fatigue, feeling tired all the time. Sometimes VT shows up as sleep problems, such as difficulty falling asleep or staying asleep, or sleeping too much. Of course, physical symptoms like these can also have other causes, so it may be wise to get a medical checkup if symptoms become severe or persistent. Finally, the effects of vicarious trauma can lead to changes in our behavior. One common example is withdrawal from other people. This might mean avoiding social situations or not feeling the desire to be around friends or family. Excessive focus on work, getting immersed in work to the point of overdoing it, can also be a sign of VT. This can be hard to recognize because it looks like being responsible and dedicated. But when it is excessive, such intense focus can lead to emotional effects and even to decreased effectiveness in our work. Another behavior change that overlaps with the emotional effects could be emotional outbursts like anger or episodes of crying. There are also behaviors that can become excessive and cause problems when used to deal with stress. For example, engaging in risky or unsafe behaviors, drinking too much alcohol, frequent overeating, or taking too much medication or abusing drugs can lead to dependency, addiction, or unhealthy habits which become problems in their own right. These are just some of the many possible mental, emotional, physical, and behavioral signs and symptoms of vicarious trauma. Typically, any one person does not experience difficulties in all of these areas. Individual differences in personality or past life experience influence how VT affects each of us. For example, one person may experience primarily physical symptoms, while another may have mostly mental symptoms. Remember though, in this discussion we are talking about mental, emotional, physical, and behavioral effects that are specifically results of exposure to trauma stories. As trauma workers, sometimes we may notice we are having difficulties, but do not immediately recognize the cause. There may be other causes not related to VT, but recognizing that vicarious trauma is a possible cause can help us take the correct steps to address the issues. Once again, we want to emphasize that these kinds of effects and reactions are common among people who work with trauma survivors. I have certainly experienced some of them myself. I've had nightmares in which I was being tortured or seeing someone else tortured. There have been periods in my life when I felt withdrawn and distant from other people and felt emotionally numb. And there have been times when I've felt that I didn't have the emotional strength to listen compassionately to more trauma stories. The importance of recognizing these kinds of experiences is that when we become aware of them, we can take appropriate action to care for ourselves. We would like you to take some time now to think about your own experiences and write your thoughts in your journal. Do any of the effects we've been talking about sound familiar to you? Have there been times when you experienced some of these mental, emotional, physical, or behavioral effects? Has someone else expressed concerns about your behavior changes? What have you noticed? Were there particular stories or circumstances that contributed to your experience? Take some minutes now to write in your journal. So, we have described what vicarious trauma is and the effects it can have on us. As people who work with trauma survivors, there are several important things about VT that we should keep in mind. First, vicarious trauma is real. It is a phenomenon that can and does occur with people who work with trauma. Vicarious trauma is normal. It is a natural human response to working with trauma. Experiencing vicarious trauma does not mean that you are sick or weak or in the wrong job. Vicarious trauma is linked to empathy and caring. Some of our most important therapeutic qualities, empathy and the desire to help, also make us vulnerable to VT. Vicarious trauma is a process. It can take time to develop and time to learn to manage. Vicarious trauma is variable. It can range from mild to severe. Vicarious trauma has recognizable signs and symptoms, though it can sometimes be difficult to see them in ourselves. Work with traumatized clients can have both negative and positive effects. It is important to remember that working with trauma survivors is also rewarding and empowering. We will talk about one positive effect called vicarious resilience in another lesson. Finally, there are ways to prevent, manage, and transform the negative effects of trauma work, and ways to enhance the positive effects. Now, let's look at some of these ideas in more detail. First, vicarious trauma is real. For more than 20 years, VT has been a topic of study in the mental health profession. It appears in professional literature, and clinicians all over the world have recognized it and developed self-care strategies to manage it. You will find references to some of this literature at the end of this lesson. Second, vicarious trauma is a normal and predictable outcome of helping others who have had painful, traumatic experiences. It is a natural process in which our emotional experiences and relationships are disrupted or changed. This happens because we care, because we empathize. Empathy is the ability to identify with another person, to understand someone else's feelings, and to identify with their circumstances on a deep emotional level. People who work in helping and healing roles tend to be high in empathy. As trauma workers, we strive to make a difference in the face of loss and devastation that our clients have suffered. Our desire to help and our empathic connections with traumatized clients can leave us vulnerable to vicarious trauma. It is very important to understand that the ability to empathize is one of our most valuable therapeutic skills. Research consistently shows that empathy is one of the most effective components of psychotherapy interventions, no matter what theoretical or clinical approach a clinician uses. However, when we open our hearts to hear someone's story of torture, loss, devastation, or betrayal, we also open our hearts to feel their pain. And that pain can affect us in ways that are similar to the PTSD, the depression, and the other symptoms that survivors of torture and trauma themselves experience. The desire to help can also make us vulnerable to VT. Sometimes clients may need help that we cannot provide. Think about the constraints and the barriers you have found in your own work. Maybe you've had clients who needed housing, or medical care, or a job, or money to buy seeds for a vegetable garden, or papers to remain legally in a country of refuge, or a way to learn the fate of a missing relative. Circumstances that make the work slow, or even impossible, can cause feelings of failure or frustration. In these situations, empathic caring, combined with disappointingly slow progress, can translate into vicarious trauma. Now, once again, we would like you to take some time and use your journal to reflect on this aspect of our work. Recall a time you felt a strong sense of empathy with a particular client in a particular situation, and when your awareness of that person's suffering was painful or difficult for you. Write some thoughts about that experience. See if you can recognize how your own distress was a natural response to caring about your client. It is also important to understand that vicarious trauma is a process. It develops over time. While it may be significantly influenced by a single event person, story, or situation, it is typically a cumulative response. Our feelings of grief, sadness, anger, and outrage may grow as we repeatedly hear about and see people's pain and loss and hear stories of human cruelty and indifference. Over time, VT can also take the form of numbing. We may lose some of our ability to care about others or feel that we do not want to hear their stories and problems. We may even feel angry at times with our clients. Again, these two alternating states of overwhelming feelings on the one hand and numbness on the other parallel the survivor's experience of PTSD. But remember, there is also hope in the fact that VT is a process. Because VT develops over time, there are opportunities along the way to recognize and change the course of that process. So we've defined vicarious trauma, discussed its effects, and acknowledged that it is real, normal, and a process. It is also important to know that how intensely or how often a person experiences VT, or if they ever experience it at all, can vary greatly. Mild or moderate effects may be very manageable if we recognize and address them. However, severe vicarious trauma can cause significant problems in functioning at home and at work. It can lead to feeling completely overwhelmed and exhausted or burned out. And at that stage, it can even unintentionally put clients and loved ones at some risk. I have known counselors who became so stressed by working with trauma that they had to quit their jobs or take a leave of absence to get medical or psychological treatment. Others stayed home from work or avoided meeting with clients. Family conflict, depression, self-destructive behaviors, addictions, or a general decline in one's felt quality of life can occur. All of this underlines the importance of paying attention to our own feelings and actions. It is also important for supervisors, managers, and coworkers to pay attention and address warning signs in supervisees or colleagues. When we understand the normal and variable nature of VT, we can address the issues before they progress to cause serious problems. And we can address the problems that do become serious. And remember that talking with colleagues is one of the most valuable tools to do this. Sometimes it can be difficult to see signs of VT in ourselves. We may not be fully aware that we are experiencing these symptoms or how they are affecting our ability to function. Still, it can be helpful to remember that vicarious trauma does have recognizable signs and symptoms. As we talked about earlier, there are mental, emotional, physical, and behavioral symptoms that can be signs of VT. You will also find a list of key symptoms among the resources at the end of this lesson. When we, our families and colleagues, are aware of VT as a normal process and of the signs that may indicate VT, we can watch for these signs and have greater understanding and compassion for ourselves and others who experience VT. While this lesson focuses on the challenges of working with clients who have suffered trauma, it is important to remember that work with trauma survivors also influences us in positive and empowering ways. Intentionally paying attention to these positive effects is one of the ways that we take care of ourselves. Please return to your journal now to reflect and write about one or more of the ways that your work with trauma survivors has positively influenced you. Here are some that occur to me. You might identify with these or think of others. The opportunity to be of service to individuals, families, and communities. The ability to use our skills and knowledge for healing. The opportunity of employment that is personally rewarding. The opportunity to contribute to the struggle against war and torture. The opportunity to contribute to the advancement of human rights. And the opportunity to witness the resilience of the human spirit that our clients show in their recovery. Take some time to write in your journal now.
In summary, Vicarious trauma is a normal and common phenomenon among people who work with trauma survivors. It comes from caring and facing the realities of trauma. Vicarious trauma can affect us mentally, emotionally, physically, and behaviorally. There are recognizable signs as well as steps we can take to help protect and care for ourselves. VT is a real, normal process that happens because we have empathy and a desire to help. Vicarious trauma affects different people in different ways and to different degrees that can affect quality of life and work, even to the point of being disabling. There are several resources in the PATH portal and on the Internet to support you in your self-care. In summary, the Partners in Trauma Healing, or PATH project, provides support for 10 partner centers in 10 different countries to help those centers build their capacity to provide services to torture survivors. The project focuses in 3 areas to help partner centers build capacity. Those areas of focus are mental health and treatment, also called the clinical focus, organizational development, and measurement and evaluation. The components of the PATH project include subgrant funds to help organizations achieve goals outlined in their capacity-building plans, periodic in-person consultation visits with PATH advisors, ongoing consultation and follow-up from PATH advisors by phone, email, Skype, or other means, a 1-year placement of a psychotherapist trainer, an annual workshop, and e-learning and online discussion opportunities through the PATH portal. The current PATH project is funded by USAID through September 2015.